it really is becoming more and more important to be proactive in implementing any best practices you can so that you are managing your labs, billing, your claims submissions, your denials very closely to reduce your risk of reduced reimbursement or clawbacks later, audits, and all of that. So let's talk about what some of those additional issues are. Erin and Megan talked about the PAMA cuts and how that hits us on the clinical lab fee schedule. Every year, we see reductions to the physician fee schedule from Medicare. And as we know, a lot of commercial products in the marketplace base their allowable rates on Medicare's physician fee schedule. So every time we see a cut to the Medicare physician fee schedule or the clinical lab fee schedule, that's going to hit providers in many areas of their revenue cycle, not just to Medicare. So that's one factor that constantly drives down reimbursement. And then over the last several years, we really have seen the MolDX program and the associated LCDs and NCDs for better managing reimbursement related to molecular diagnostic services. We're seeing those policies become adopted more frequently again into the commercial marketplace. And so even those labs who don't necessarily work in a MolDX MAC, and we've got other information out there from Lighthouse about MolDX if you're interested in it. But the big thing is that even if you're not in a MolDX MAC, you are probably going to run into scenarios that are being defined for reimbursement within those MACs. So it's really important to stay up on top of all of those policies. And then the private payers are just increasingly narrowing their networks. And so especially we've seen this in the clinical lab space. We have seen this in the independent pathology space. It's becoming more and more difficult for providers to join networks, even in the case where maybe you work with a group of providers and the group is contracted. We've seen examples where adding a new provider to an existing contract is an uphill battle. So a lot of things are really driving down our ability to effectively get reimbursement, and especially with the cash flow, the cadence of cash flow coming in, all of these things are really impacting that. So some things that I'm going to touch on are going to just try to focus on areas that we can protect the revenue, we can maximize our opportunities, minimizing denials, really trying to find best practices that will save your lab money on staffing needs, and reducing the administrative costs that are associated with denial management, because we don't see this landscape becoming any easier to deal with. And so what are those best practices that can help us navigate in that space? So we're going to touch on several things today. We're going to start with the documentation requirements being first and foremost. It's a very difficult position for clinical labs to be in, that documentation requirements are so heavy, because a clinical lab is a referral-based business. You don't go out to try to find your own patients. You're not drumming up business yourself. You are receiving samples from providers. So helping providers really to understand the documentation requirements, and then within the lab itself, being aware of these documentation requirements so that you can put in some really good front-end practices to ensure that we're sending clean claims out, that the revenue is going to be protected in the long run. We've got CPT codes and with the MUI or CCI edits, and I'm sorry, the MUEs or the CCI edits. And so a lot of billers are really familiar with just those general concepts in revenue cycle, that there are going to be some MUE and CCI edits. However, just putting in an edit itself to make sure that you've added a modifier, or that you drop that column to CPT code that's going to hit the CCI edits. If the final report or the medical records, the clinical documentation itself isn't actually accurate, if it's different from what you're billing out, then we could run into problems down the road. And we want to try to avoid that as much as possible. We want to make sure that the money that we're getting in the door and into the bank account gets to stay there, and we don't have to worry about somebody coming back later and taking it away from us. So the detailed documentation is just really important, and not even just for the clinical lab space, but we make a point here to call out the newer LCDs from the Palmetto and WPS Max, who have started talking about what additional documentation requirements they have for IHC stains in the pathology space. And those are commonly performed in a pathology laboratory. And so if you are in these MACs, Palmetto and WPS, we've got some more information about that out there as well. But the documentation requirements in the entire lab space are becoming more and more challenging for providers to meet. And so it's important that you stay on top of those changes.